So we're currently in Rwanda. So Muraho meaning hello. So it's HIV Awareness Month, and I have today a guest on my channel. Kate will be giving you all the highlights, all the tips, all the do's, all the myths on HIV, what you need to do, how to prevent, how to improve your lifespan and everything. So stay tuned and learn. So what's HIV? HIV is an acronym for Human Immune Virus. There's a difference between HIV and AIDS. AIDS is acquired immunodeficiency syndrome, which is a situation whereby your immune system becomes inadequate to be able to fight infections that on a normal basis, if you were okay and fine, your immune system was fine, you'll be able to fight these infections without the use of antibiotics or supportive therapy.
Now, the signs and symptoms. When you do present with signs and symptoms of HIV, it's when your immune cells have greatly reduced in number, and so you present with opportunistic infections, which you normally wouldn't have if you were immunocompetent. The signs and symptoms we have are fever, asthenia, anorexia, night sweats, and other things that come up along the line as your immune cell count reduces. We have cerebral toxoplasmosis, which could later on become an abscess. We have pulmonary infections like pulmonary TB and other pneumonias that could in the long run result to an abscess in the lungs. We also have recurrent diarrhea, vomiting, and all of that.
Now, how is HIV transmitted? In a simple way, HIV is transmitted by when the blood of an infected person gets into the bloodstream of an uninfected person. So it could be through any means. It could be through sexual intercourse, through sharing contaminated blades, through shaving, any of these means, any way you can think of it, as far as the blood of an infected person gets into the bloodstream of an uninfected person, the person is going to have HIV.
Now, for the prevention of HIV transmission, so we are preventing the blood of an infected person from getting into the bloodstream of an uninfected person. So the first barrier measures are to prevent or to stop having multiple sexual partners. We have abstinence. We have prevention. You don't share all of the sharp objects, blades, and all the others. Okay, as an aside, for women who are HIV positive and are breastfeeding mothers, breastfeeding is one of the means of transmission of HIV. So here there's a particular, if the viral load of an HIV positive breastfeeding mother is really high, we advise that you don't breastfeed your child.
Now, for the management of HIV, the new rule is test and treat. If you're being tested for HIV and the result is positive, you're immediately placed on treatment. And there's a goal, the new WHO goal, which is 95, 95, 95, meaning 95% of the population should know their status. The next 95 is 95% of the population should know their status, and 95% of the population that are HIV positive should be on treatment. And the next 95 is 95% of the population should know their status, and who are HIV positive are on treatment and should have an undetectable viral load. So that is the new rule.
Okay, so this is all you need to know about HIV.
HIV is not a life-killing death sentence. You can have HIV and have a normal life. Follow the rules we gave, follow the knowledge we gave, and you will be fine. Protect yourself, protect your family, and protect your friends. HIV is not a death sentence.
Peace.
I hope you enjoyed the video. Thanks for watching. See you in our next video. Bye.